Good morning. So I am here to meet with my friend, Dr. O. She is an OBGYN, and I'm just getting my annual exam. So I may ask her a few questions. We'll see how it goes, all right? Get yours. To start each GYN examination, the staff will request that you give a urine sample. Just a little bit. They send it off to the lab, and this test is for if you have any infection or disease or pregnancy or anything. It could tell if you're dehydrated, gives a lot of information. So it's very important. And just remember, if they ask you for a sample, to give a sample of the urine. And it's just still, again, to keep us healthy and to know more about how our bodies are functioning. It should be of this consistency. This states that you are hydrated and full of water, this lighter color of urine. We don't like dark color, ladies, light color. But certain foods and things that you drink can discolor the urine, also certain medications. But if you're not on those medications, the urine should be of this color. Okay. So the next step is when you come in, they'll get your weight, your blood pressure. Then you would drape yourself with this thing. So your feet will go in something like this, also in something like this. We're just waiting for the doctor now. And play your music. Okay, so I'm waiting for my doctor to come in. I put in my headphones to listen to some relaxing music because the procedure is quick, but it can be a little uncomfortable, especially if it's your first time. I'm draped and ready to go. Okay, this is Dr. O. She's a phenomenal OBGYN for all of your needs here in Rockland County. So the question I have for you, Dr. O, is if there is a first-time visit,
yes,
what do you recommend the age and what should one do?
I think it's different for the individual. We can start seeing GYN patients starting at age 13 because, a lot of young women have lots of questions before, they get older that they don't feel comfortable talking to their, parents about. I find that it's easier when you come early just to start talking to a gynecologist, just to answer questions that you may have, so that down the line you're more familiar with your menstrual cycle, more familiar with your body, and just more familiar with, information regarding women. So I would say 13, but most of the time people start coming when they have a problem later in age.
So should people only come see you when they have a problem?
No. I think it's better if you come in before having a problem, because then you learn ways to prevent disease. You learn how to, care for your body. You learn about your body. So I wouldn't say just come in when you have a problem. So come in before.
Come before. And my last question. So what's the difference between an STD and an STI? And what can we do or ladies do to prevent any type of infection, self-care? We're in the home right now. So maybe a lot of virtual sex, but regardless, what can we do for hygiene? And what's the difference between STD and STI?
Okay, so that's a good question. So for me, I find that it's an infection just means that you have a, how should I say, like a bacteria, a virus, but a disease is the manifestation of that virus or that illness. So it's kind of like a long-term, condition. So if you have an infection, most of the time you can treat it and cure it, but sometimes these infections can lead to a disease that you potentially can't cure. So I think that sometimes it's hard to make them equally the same. And then in terms of how can you prevent getting STDs or STIs is literally, knowing your body, knowing your sexual partners, because most of these diseases you get from sexual partners, and the more sexual partners you have, the higher chances of you getting diseases like herpes, HPV, which a lot of women learn about when they first come and get their first pap. But I think knowing about all these things before you start having sexual encounters or relationships is the best way to prevent disease. And then what was your other question?
What can ladies do as far as personal hygiene to keep themselves, healthy down there? healthy.
That's a hard question too. But I would say first, taking care of your body, being healthy, exercising, eating healthy, eating well, because that all, how should I say it? Regulates your hormones, regulates how your body presents itself. So I would say the best thing to do is, exercising, eating well, taking care of your body, stress reduction, and then once you are sexually active, knowing your sexual partner, knowing your sexual partner status, because those are, the ways things come encounter with us.
Absolutely. Okay, so you heard it.
Don't be afraid.
Don't be afraid. Come see Dr. O.
Bye.
Okay, it is a great day and we are finished. You met Dr. O, my lovely friend. She is a phenomenal OBGYN. She's located in Rockland County. I encourage you to schedule an appointment with her. She will take care of you. Whether you're seeking to become pregnant, you are interested in those burning questions about sexual needs, and she'll be there to guide you through it very gently in a very, very, very sensitive way. So you've gone through with me through my day of how it looks to come in to have your annual GYN exam, pap smear, breast exam done. It's COVID. No one wants to come out, but it is important. COVID-19 compliance. I felt very safe and I feel good. I feel really, really good today that I had the chance to come to take care of myself, because you have to love your mind, your body, and that spirit. We got to keep it alive and do all that we can during this pandemic to stay healthy, okay? See you later.